Well, it gives me great pleasure to be here. It is truly an honor for me to represent oral health on the IOM Roundtable and to provide you some background on what's going on around activities to educate the profession of dentistry, including dentists and our dental team members, hygienists, and dental assistants, on oral health literacy. And we have a long ways to go, just to give you a heads up. And I'm gonna frame it in terms of past, present, and future activities. So just a little slide on the visions of and the missions of the California Dental Association, the vision of the American Dental Association. Organized dentistry is going to play an even greater role in educating our professionals. We have a very large market share compared to medicine, I think, in general, and it's a responsibility of these organizations to do this. The ADA vision is to be the recognized leader on oral health, and the CDA missions. This mission of CDA is committed to the success of our members and service to their patients and the public. And our foundation's mission is to improve the health of all Californians by supporting the dental profession in its effort to meet community needs. So just a brief history of our past, and this is going to be very, very quick. Major milestones. The Surgeon General's report of 2000 came out, and that really put oral health on the map for us because it talked about how the mouth reflects general health and well-being, and the research findings that point to the possible associations between periodontal, plain language gum disease, and that relationship with diabetes, heart and lung diseases, stroke, low birth weight babies, and premature births. And the phrase was coined, and we hear this many times in the media, dental caries is the single most common chronic disease of childhood, 5 times more common than asthma, which is pretty remarkable. And then there was the National Call to Action, which was a follow-up to promote oral health in 2003, and that really highlighted the importance of public-private collaboration. And then the NIDCR, the National Institute for Dental and Craniofacial Research Workshop on Oral Health Literacy in 2004, the Invisible Barrier Literacy and its relationship with oral health, and really putting together a national plan for research. And then ongoing past, present, and future research around oral health literacy, especially the projects by Drs. Jessica Lee and Gary Rozier from the University of North Carolina. They're working on developing oral health literacy assessment tools in certain populations. And I didn't put it on here, but the University of Maryland, under Alice Horowitz' leadership, doing a tremendous amount of work on oral health literacy. And then since 2001, health literacy has been included in the annual sessions of most major dental organizations and government-sponsored meetings, pretty much all across the board. The American Public Health Association, the American Association of Dental Research, the American Association of Public Health Dentistry, and the ADA and the Hispanic Dental Association. And then the past continued. And this is specific to the American Dental Association. In 2006, the ADA House of Delegates adopted the health literacy definitions and policy statement. And they adopted the definition that was in the material from the IOM. So the IOM has a tremendous influence in this country, and it's really, it was, and the ADA was willing to make those early investments based upon the prescription to end confusion. 2007, the ADA established the National Oral Health Advisory Committee, and then shortly thereafter, in 2009, they developed the Health Literacy and Dentistry Action Plan, 2010 to 2015. And in 2009, also, in accordance with the research objective that was in the Health Literacy Action Plan for Dentistry, the research was conducted, survey research was conducted among U.S. dentists, dental hygienists, and dental assistants to determine communication techniques used with patients. And the survey results showed that the number of communication techniques used routinely varies greatly among dentists. There's low use of techniques most commonly recommended by health literacy experts, such as the teach-back method is used only by 20% of dentists. The routine use of techniques was similar to physicians, nurses, and pharmacists. And little over 73% of dentists had never had a course in health communication, although most of them would be interested in taking such a course. And then moving on to the California Dental Association, the CDA Journal on Oral Health Literacy, First Smiles Education and Training Project, the Oral Health During Pregnancy, that's the evidence-based consensus conference that we convened to establish guidelines for health professionals on treating pregnant women. CAMBRA, which stands for the Caries Management by Risk Assessment. And then ultimately, CDA decided to fund the seat on the Health Literacy Roundtable. So just quickly going through those. The journal came out in April of 2012, and I had the honor of guest editing this journal issue around this very important single subject, and it's one of the few dental journal issues that was devoted to oral health literacy. And so on the cover, we wanted to think of plain language and the words that we needed to address from A to Z, and Z was not an easy one to come up with, but we finally managed zygomatic arch. I'm not sure how you convert that to plain language, but how about right here? So, and then the articles that were contained in the journal issue, the first one was the ADA National Plan to Improve Health Literacy in Dentistry. And then the next three were from the University of Maryland, Alice Horowitz's shop, Oral Health Literacy at the Intersection of Schools and Public Health, creating a health literacy-based practice, which was really focused on the private practice community, which is the majority of dentists, thinking about incorporating best practices into their clinical practice. Maryland dentists' knowledge of oral cancer prevention and early detection. Well, that study showed that if the dentists and the hygienists don't understand early cancer prevention, what it looks like, doing an appropriate oral cancer exam, then the public is going to be in really bad shape because the public is relying upon their professionals to do their job. And then health literacy in California is clarion call. We heard earlier from Dr. Koh that the demographics are shifting enormously in this country, and that has certainly already occurred in parts of California, where many of the counties in the Central Valley are primarily Hispanic and primarily speak English as a second language, and so we have to pay attention to that in California right now. And then finally, some thoughts on improving access to oral health care for vulnerable populations. And that was a commentary written by a community health worker in Illinois working with the migrant farm community and incorporating oral health literacy messages within the work that a community health worker does in the community. And then CDA Foundation activities. The First Smiles program was a $7 million grant we got 10 years ago from First Five, which is funded by the tobacco tax dollars. And it was an education and training program for both dental professionals and medical professionals on early detection and prevention of early childhood caries, which is early cavities in very young children. And we shared the grant with another foundation, and there's still a lot of material on the website, and it's translated into 10 different languages for professionals to use to understand how to prevent tooth decay, how to assess it, and how to deliver primary prevention. And then oral health during pregnancy and early childhood, the consensus conference that we convened, which the goal was to make dental professionals understand that it was safe and it was their responsibility to treat pregnant women. It's amazing how many dentists still are very uncomfortable treating pregnant women, and develop evidence-based guidelines looking at the latest literature and where you identify the gaps, you ask the experts. And so we came up with these guidelines, and we disseminated the guidelines through a journal issue. We also developed a policy brief to support it, and then I edited another journal shortly thereafter to encourage dentists to incorporate the guidelines into their clinical practices. And then CAMBRA, Caries Management by Risk Assessment. CDA has been very involved with this movement, and it's really a paradigm shift in dentistry to think of treating dental disease as a chronic disease rather than a surgical type of repair. It can be managed, it can be prevented, just in the same way that diabetes and other chronic diseases can. And so in order to promote this, we've developed a lot of tools and resources that are available. Many of them are available online. We had a consensus conference in 2011, and all of this material is available through our several journal issues. We also are currently co-funding a practice-based research network with dental professionals in their private practices, and there are also some FQHCs who are incorporating the guidelines into practice. And then finally, IOM Health Literacy Roundtable activities. I was a presenter. I was asked to present at the 2012 workshop on oral health literacy, and that ultimately led to us funding the seat on the roundtable through 2015. And then I was one of 4 authors that developed a discussion paper on an oral health topic, and that was After Visit Summaries, a tool whose time has come for use in dentistry. And it was Dr. Horowitz, Manwei Ng, who is a pediatric dentist at Harvard Children's Hospital, and Amit Acharya, who is from Marshfield Clinic Foundation in Wisconsin. And looking at the After Visit Summary as a powerful tool that could be used in dentistry, and also a piece of the larger puzzle, especially in in an integrated healthcare environment where you have dentistry and medicine practiced under one roof, or they're associated with each other. FQHCs are a good example of this, and how you can promote health literacy and oral health literacy using very similar the same resources. And then past continued Maryland, the health literacy model, the prevention and early detection of dental caries. And this model is meant to address the challenge of the mismatch between the demands of the healthcare system and the skills of those using the system and working within the healthcare system, with the specific focus on the prevention of cavities in children. And ultimately, users need to understand that oral health is part of total health, and we can keep our mouths healthy. Healthcare providers need to understand how to best meet their needs, and the systems need to facilitate communication in a supportive and patient-centered environment. So the goals, you can read them, of the model were the bullet points there: establish local and state needs, especially in assessing the public's perceptions of providers' communication skills, what the public knows and doesn't know about cavity prevention, what providers know and don't know about cavity prevention. And the results for the general public: they don't understand how to prevent tooth decay, they don't know what fluoride is or what it does, they don't know what sealants are or why they're used, and often they don't drink tap water, and this is especially unfortunate because for low-income populations, because they have access to fluoridated water, which is proven to be cost-effective in reducing and eliminating tooth decay. And results for health providers: many do not have a good understanding about how to prevent tooth decay, and this includes dentists and dental hygienists, which is quite shocking. Many do not provide dental sealants in practice, and most healthcare providers do not use recommended communication techniques. And so the results of the environmental scan, or actually I should say to improve communication with patients, because the scan showed that in most cases dentists and dental providers were not using these tools as they should be using the tools. And you can see the improving the communication with patients. These are the classic health literacy principles. So on to the present. The ADA just last spring sent 2 staff to the Institute for Healthcare Advancement meeting last spring to learn the basic principles of oral health literacy. They're in the process of revising all the patient education material to conform to health literacy principles. CAPER, which is the Council on Access Prevention and Interprofessional Relations, is providing content expertise for IHA publications. The ADA convened a CE course last week called Health Literacy Foundation of Patient Understanding. They've reconvened the National Advisory Committee on Health Literacy and Dentistry. The ADA will take over the funding of the oral health IOM seat this spring, and they are looking at all ADA policy to see if it can be updated to promote the use of health literacy principles within the organization, and research continues. And for the future, the ADA is positioned to be a leader on oral health literacy. They're going to continue funding the seat. They're continued. They are committed to continuing supporting the advisory committee, and they are going to adopt the 10 attributes of a health literate organization. That's, the executive director said that last week at the CE course, so we're going to hold her to that. Educating members about health literacy principles, and there are a variety of ways that we're going to be doing that. Exploring opportunities to collaborate with other organizations and support. And I just want to give you a case example of one of the 10 attributes. Number 3, prepares the workforce to be health literate and monitors the progress. And we've just in the last week started to look at the accreditation standards for dental schools and dental hygiene education, the curriculum, and we're going to identify the sections where we can make some changes to make sure that we add specific language that that health literacy principles be taught in educating the professionals on health promotion and prevention within their dental school experience. And CDA will be working with a new state dental director. We will be hopefully hiring one by the end of the year to incorporate health literacy principles within the work of state government and the programs meant to improve the public's oral health. Maryland, the research is ongoing, as it is in North Carolina. The bottom line, health literacy is inextricably linked to improving oral health, especially among low-income groups. Each of us has a role, opportunity, and responsibility to improve oral health literacy of patients, providers, and the public. Together, we can put Annie together once again. Thank you.